Good morning, everyone. My name is Mr. Prosper, and I remain your point one teacher. So, welcome to today. Um, Before I continue, I want to say something about the content I usually drop. First of all, I am a real life teacher. I teach for real. All right, that's what I do. I teach both adults and children. So, in a school also, in a recognized school, and then off school, up work, online, offline. All right, so that is what I do. That's my profession. And most of the question you see I treat spawn from my student asking me questions. Sometimes they just ask me a question that some of them are always shy of asking. So when they ask, you notice that a lot of them are interested in such topic, and so you tend to give a general answer. All right, so that is how I usually come here also to drop such answers, so people who are in the same category can also learn from it. So having said that, so my content is basically on demand. It's what I am asked that I always drop here. That's why if you notice, some of the things I talked about are not fully finished, because the feedback I get, some people, my audience almost have already gotten what they want to hear, or they are already satisfied with the content, so I just end it. Why some I continue, because they also inquire to know more. So having said that, while teaching yesterday, my student asked a question, that why is it that our parents nowadays, recently, 70 to 80% always give birth through cesarian section, through C-section operation. Why? What is wrong? And I categorically told them that I am not a medical doctor. I'm not a medical doctor, so I can't give them an answer, a particular answer or reply to that. But I will try to give them an answer from a biochemist perspective, because not biochemist per se, but from the topic I already explained earlier, FGM. I said I was going to answer them from FGM as a topic. All right. But then, before I went to explain to them, I gave them an instance. I gave them an illustration that if those of them that are Christians who can remember that back in the Bible, all the people there, all the humans in the Bible that were talked about, they lived 400, 600, 800, 900 years. Methuselah and co. So you see that life expectancy then so high. All right, so high, and it can come from a varieties of factors. All right, a varieties of factors. These factors include your food. All right, your nutrition is very, very important. Your nutrition, the kind of food that they were eating and the one we are eating now. Then we'll talk about, like I said, this is not what I want to talk about today. I'm just trying to get you a rose for what I want to explain. Then we have environment. We have global warming every day. All right, effect of CO2, carbon dioxide, carbon monoxide, sulfur dioxide. What I mean is the smoke you are inhaling when you are traveling from the different vehicles. All right, all those ones are detrimental to the health. Then we also talk about other factors which I don't want to go into. That is not the main topic. So I told them those are the things that gradually reduces life expectancy, and the same thing applies to that of childbirth. But I now bring it to them that there's a particular FGM. FGM, like I said, is female genital mutilation, known as introcision. Introcision is a practice that have been going on long ago by some major part of the continent. Actually, we have the Aborigines in the Australia side. We have them in Peru, Indian side, the northern Indian part. We also have them in Africa, West Africa, the kind of practices. Now, so this kind of practice is when the girl reaches puberty, from puberty age, this girl is called and gathered by the tribe people in front of the tribe, and then she's mutilated by an elderly human. What I mean by mutilated, they will first, some tribe, depending, they will intoxicate her, give her something to make her a bit high, so she gets intoxicated. Then an elderly woman can use a stone knife, a bamboo knife, or firstly she will use her hand, 3 fingers, and insert it into her vaginal orifice. and widening it, tearing it downward, breaking through her hymen. You understand? She will use 3 of her fingers, insert it into her vagina orifice, tearing it and breaking it downwards. So after that, she's then allowed to have a compulsory sexual intercourse with FT men, big men, not one in the community. Then that is it. Then she will, that is puberty. Then when she get matured a bit also, then the woman can now use the bamboo knife or stone knife to cut through the hymen. Then they will give her some herbs, you understand, that she will, that to tighten up the place back and all that. Now this happened at a very early stage of a girl's life. Now you know that during the days of our forefathers, our grandmothers, when they want to give birth, we used to hear the story that she would just want to go to ease herself, to pee, you understand, or to just take a bath. Before you know it, the child is coming and she can just from there, please, oh child, she just give birth to her by herself without even stress, undergoing anything. Now I want to ask now, do you think that such practices, this FGM practice that I just said, that was carried out by our forefathers, do you think it helped them in childbearing or not? Because from statistical studies, almost all these women undergo this mutilation, and their childbearing were easy, were not stressful, and nothing was done like cesarian section. Do you think it has a part to play in childbearing? So you come to the comment section, you tell your view, you share, you like this video, and let's see if we